you feeling?
Good.
It's going to be a long day.
It's fine. It's what we do every day.
That's Corey Diedrich. He's about to embark on a very long journey to deliver vaccines to rural communities across South Dakota. And we're tagging along.
Presho, a small town in central South Dakota, is actually the town I grew up in. So the vaccines that are going to Presho are going to end up in the arms of people that I've known my whole life.
The route? 425 miles, 5 stops.
Our territory is vast. Weather's a huge concern. For the vast majority of our days, though, we run 99.7% of our routes on time if you look at it from an annual standpoint.
Corey is the Director of Transportation and Logistics at Sanford Health. They're one of the 3 main health systems leading the charge in vaccinating South Dakota. Just a couple of months ago, South Dakota had some of the worst COVID death rates in the world. But now, they're among the top states for vaccinations per capita. 13% of the state's population has received a shot, and about 6% has been fully vaccinated. Not an easy feat for an expansive state with half its population living in rural areas. Even before COVID-19 hit, Sanford Health had a courier system for shuttling medical supplies and lab work between their metro hubs and these small hospitals and clinics. Sanford expanded this existing system for COVID-19 vaccine delivery. Corey's first stop is Sanford Medical Center in Chamberlain, population 2,600.
We weren't able to get vaccine in Chamberlain and get folks vaccinated. They could be facing a couple 100-mile drive. You know, Chamberlain, this hospital, we are the only hospital on the interstate between Mitchell, South Dakota and Rapid City. That's over 275 miles. We really need to make sure we're able to get the vaccine as close to home for folks as we can.
Chamberlain was devastated by the virus. This hospital serves folks in Brule, Buffalo, and Lyman counties. In Buffalo, 1 in 5 people have contracted COVID. In Brule and Lyman, it's around 1 in 10.
You grew up in this community. How hard was it to see the impact of COVID-19 on your friends and neighbors here?
It was very difficult. I mean, just taking care of patients in the ER, even in the clinic who had COVID, seeing them go to Sioux Falls and some of them not even coming back, it was difficult to see.
Harlan, what arm would you like it in?
Nurse Brittany McDonald often treats and vaccinates people she knows.
What does it mean now to be vaccinating your neighbors?
It's huge. People are excited to start going to church again and maybe going out and see family that they haven't seen in a year, and they're so grateful to be able to just come to their backyard and get a vaccine.
Next stop is Presho, population of about 400, and Corey's hometown.
So we're very happy to have you guys here. Yeah. Very proud of our sons.
But it's not just Corey's family that's happy to see him.
Follow Rosemary that way. What's the feeling for you guys when one of these guys walks through the door?
Well, so very exciting, obviously. We didn't think we were going to get vaccine here until the summer. So getting it now, and we have a lot of high-risk patients and elderly patients that just didn't want to travel to get their vaccine, and so they were basically waiting till we got it here.
These facilities need to use doses quickly because they don't have cold storage.
How many doses are you delivering here?
250 to winter.
Rural areas have been historically underserved and yet are at high risk for COVID-19. The population is elderly with high rates of chronic disease and poverty. Plus, the indigenous community in South Dakota and across the country is especially vulnerable. And if the dirt roads and the bison don't make it clear enough, access is a very real challenge.
We've been following Corey across this massive stretch of land that Sanford covers, and it's been a little bit of white-knuckle driving on these small rural roads. It's negative 18 degrees today. We've had ice and snow on the road, windy conditions, but Corey's team, they do this every single day.
We've seen you deliver 500 vaccines to a place like Chamberlain and then 20 doses to a place like Presho. To some folks, 20 doses might not seem like a lot, but why is it important to get doses to places, whether it's hundreds or whether it's just dozens?
But it's 20 doses that matter to 20 people in Presho. And those people weren't able to go to Chamberlain and get doses or to Pierre for another location. It mattered to those people, so that's why it matters for us. Hello. All right.
80 doses delivered to the town of Burke, population of about 600 people.
This is kind of a next step out of this pandemic.
And last stop, Armor.
We have 60 doses for Armor today.
60 doses for Armor.
This week, Sanford delivered 3,200 doses to 17 rural sites across South Dakota. Corey says they could do much more if they had more supply.
If they asked us to move vaccine more tomorrow and do it again, we would make it happen.
Hey, NBC News viewers, thanks for checking out our YouTube channel. Subscribe by clicking on that button down here and click on any of the videos over here to watch the latest interviews, show highlights, and digital exclusives. Thanks for watching.